SOAP template. Field 1. This is a 55-year-old gentleman who comes today in follow-up of his coronary artery disease period. He has a long cardiac history and underwent 3-vessel bypass surgery at the age of 35 period. He has undergone multiple percutaneous interventions over the years period. About a month ago he presented with unstable angina and was found to have a fairly severe disease in the graft to his obtuse marginal branch period. He underwent uncomplicated thrombectomy and placement of 3 Cypher drug-eluting stents into this graft period. He had apparently done well until yesterday afternoon while climbing some stairs, carrying a load of laundry period. At that time he noted the onset of a open quote pressing close quote sensation in his central chest, very reminiscent of his prior angina period. He was diaphoretic, nauseous, and somewhat lightheaded period. He ended up sitting down on his bed, taking 3 nitroglycerin tablets, and eventually noting relief period. Overnight he had several episodes of discomfort awakening him from sleep period. He thought about calling 911 but was afraid he might be calling a false alarm, so decided to stay home, and later called my office and scheduled this appointment period. New paragraph. Beyond the symptoms yesterday, he had been doing quite well period. He is very vigilant about taking his medications period. He has been very cautious and appropriate in his eating period. He checks his blood pressure periodically and it has been well within the normal range period. On physical examination he appeared in no acute distress period. His blood pressure was 120/70, pulse 65 and regular, and weight 180 pounds period. Normal head, normal neck, normal lungs. His heart exam revealed a regular rhythm with a grade 2/6 holosystolic murmur at the apex, open paren, this has been heard previously, close paren, period. He had a soft S4 period, normal abdomen. His extremities were non-edematous bilaterally, period. New paragraph. 12-lead EKG, This revealed normal sinus rhythm at a rate of 65 period. He had deep precordial T-wave versions, period. This gentleman is presenting with recurrent angina, which sounds fairly convincing for cardiac ischemia, period. Given the frequency and duration of his symptoms overnight, I would not be surprised if he has suffered from yet another myocardial infarction, period. Arrangements are being made for his immediate transfer to our local hospital, where he will be stabilized and likely evaluated with heart catheterization, period. Transfer to Dartmouth Hitchcock Medical Center. List 2. Heparinize. List 3. Serial cardiac enzymes. List 4. Likely heart catheterization later today or tomorrow.